Good morning. Having bariatric surgery is a significant event in patients' lives, therefore providing support for the period before the operation and after the operation is very important. The decisions to uh, undergo bariatric surgery is difficult for those patients. They feel ashamed or embarrassed that they have failed different weight loss methods and now they have to undergo this external fix, which is surgery, because they failed all those methods. This is a study by the King's College where more than 150,000 patients were involved, and it shows that the probability, if your BMI 40 and above, to achieve a normal BMI with the conservative options is less than 1 in 1,000. The question is why those patients want bariatric surgery. Appearance is not the main reason. Those patients want bariatric surgery to improve their physical fitness, improve their comorbidity like hypertension, diabetes, improve their psychology, their confidence, and escape from this prejudice that the community enforce on them, and obviously to be more active and be able to work. It is very difficult to argue against the success of bariatric surgery. This is a study from Sweden um, and show the change of weight over 15 years. The top blue line show patients who had different type of conservative options, and after 15 years their weight is much about the same. The bottom three lines, which represent patients with different bariatric surgery, and after 15 years the result is that they not only lost the weight but they maintain the weight loss. The most effective way surgery was gastric bypass. People usually talk about the risk of having bariatric surgery while they should talk about the risk of not having the surgery. This is the UK National Bariatric Surgery Registry and showed the resolution of diabetes. So out of 100% of patients who had diabetes before the surgery, 2 years after surgery, they showed the patients who still have the diabetes is only 20%, so 80% resolution of the diabetes. Before the operation, I ask the patient to think about their eating habits. People in general underestimate their calorie intake by 40%. And one of the important association is the association between how empty is the stomach and the feeling of hunger. Initially, when the stomach is completely empty, patients feel very hungry. And the next stage, when they eat a bit, they feel less hungry. And then if they eat a bit more, they feel not hungry. And then if you eat a bit more, they feel satisfied but not full. And the next stage is feeling full, and the stage after is feeling extremely full. And the question is, can we stop eating when we are satisfied but not full? One of the important eating habits that have to be addressed before surgery is emotional eating. This is a quote from one of my patients. They say, I love nothing more than I love food. The problem is in my head. And this usually leads to a vicious circle of emotional eating, feeling guilty because of that, and then obesity. The solution for this is the patient have to take a pause and think that food will not make these emotions any better. They need to use their time for doing different things like phoning a friend, go for a walk, do some exercise, and it's really important to eat regularly 3 times a day or 2 times a day. This is my advice for the last few days before surgery. Some patients start to say that we're not going to have any more nice meals after surgery. The food's still going to be enjoyable after surgery, and the aim is to have a healthy, balanced relationship with food. Some patients start to doubt their decisions to go ahead with surgery. This decision is based on compelling evidence. The liver shrinkage diet. Why do we need to take the liver shrinkage diet? The liver lies above the stomach, and in order for us to do the procedure, we have to lift the liver up. So the bigger the liver, the more unsafe the procedure. Therefore, we give the patient the liver shrinkage diet for 2 weeks before the surgery to shrink the liver down and make the operation safer. We advise the patient to prepare their food before surgery and think about it. This should include high protein diet postoperatively to avoid muscle loss, anemia, and hair loss. Now going into life after surgery and the recovery period. It's a keyhole surgery, so the pain after surgery will be minimal. Some patients feel a bit emotional after surgery, and that gradually settles down. It's very important to prioritize food, making sure the patients take 1.5 to 2 liters of water a day and high protein diet. It's crucial to understand the changes in the body after surgery. The patient comes to me and say, I do not feel hungry for a few months after surgery. And this is a crucial time distance during which patients have to make changes in the lifestyle and the relationship with food. The body and mind have to come together to regulate eating. It's very important to understand that surgery is only part of the answer, not the whole answer. And this is how the weight loss will happen after surgery. The majority of the weight loss will happen in the first 6 months. The weight loss will continue up to 1 year, and after that, the weight loss will stop, and the patient will continue around this weight. Life after surgery will be different than life before surgery. The relationship with food changes from food for reward, comfort, and celebration to food for physical health and need. This can still be enjoyable. The self-confidence will improve, and that will be noticeable for everyone around you. It's very important to understand that the risk of alcohol dependence will increase after gastric bypass, and a small amount of alcohol will have significant effect after this surgery. The maintenance of the weight after bariatric surgery is an achievement, and that can be maintained for years. The physical activity after surgery will improve the body image, and it can be enjoyable, like doing shopping, visiting galleries, and so on. One of the most common questions after weight loss surgery is how much excess skin will I have? This depends on the patient age, the distribution of the fat, if it's around the arms and the legs, or if it's around the tummy, how much the patient activity he or she does after surgery. The more activity he or she does, the better the result. With regard to plastic surgery, then about 90% of the patients will not require plastic surgery. It's also worth mentioning that different regions in the UK have different criteria to do plastic surgeries. There might be a contrast between different areas in the bodies after the plastic surgery. My advice for patients who would like to go ahead with the plastic surgery is to avoid doing anything like this for the first 2 years after surgery, where there will be still some weight loss happening, and that might affect the surgery if it's done within these 2 years. Changes in the relationship might happen after weight loss surgery between partners, between family members and friends, and there are different reasons for it. The partner could have weight-related issues. The eating is a bonding exercise, and that will be disturbed after the weight loss surgery. The patient himself after weight loss surgery will start to see things differently. And this also might be a chance for the whole family to change. So what I say regarding the decision to go for weight loss surgery, that this is a family decision, and the family has to work as a team to help the patient reach their targets. The last thing to talk about is weight regain after weight loss surgery. It's important to differentiate between weight regain and normal upward shift in weight that happen with time after weight loss surgery. The normal upward shift in weight is only a few kilograms. It happens 2 years after weight loss surgery, and it is much less incomparable to people who did not have the weight loss surgery. The most common reason for weight regain is people with bad eating habits like emotional eating, binge eating, and grazing. This weight regain can lead to the patient feeling back the anxiety, being self-critical, and having low mood, and going back to the old vicious circle. This can be easily addressed by the bariatric team psychologist and will lead that the patient will go back to their trajectory weight loss. It's important to realize that the bariatric surgery is not only a weight loss intervention, but actually a psychological intervention. After surgery, people feel that they are much more control over their eating habits. we should be aware of the change that happens psychologically and socially and be ready for it. Thank you for listening.